Okay. Good morning, good afternoon, everyone. Where are you calling us from? I don't know, but this is the presentation to introduce a new program, brand new program from the Global Business School for Health, and then we will take the questions at the end. But before I make a start, I would like just to introduce myself. My name is Radi Haloub. I'm Associate Professor and Deputy Director of Education at the Global Business School for Health. I'm originally a pharmacist and I'm teaching biotech and pharmaceutical management, and I lead the program. And I've got here my colleagues. Karina, would you like just to introduce yourself very quickly?
Hi everyone, my name is Karina. I'm working with marketing and communications at UCL, and I was also an ex-student. It's nice to meet everyone.
Thank you, Karina. Now, Nada.
Hi everyone, my name is Nada and I'm a student on the Biotech and Pharmaceutical Management course and one of your chairs for this evening.
Thank you very much. And we've got Barry.
Hi everyone, I'm Barry. Yes, so I'm also part of the GBSH marketing comms team. It's lovely to meet you. Cheers.
All right, thank you very much, team. So let me just move, to start with the slides very quickly. But before we talk about the program, I would like just to tell you a little bit about UCL. UCL is a home of brave thinkers since 1826, and if you ask anyone in UCL, they will tell you about the diversity of the students and staff. And at the same time, it was the first university that offered the education for women. So that will be quite interesting. We're proud to be part of this education institution. And it's the first English university that admit, as I said, females students on equal terms with men, and it has a long history of making transformative contributions to healthcare. UCL owns a lot of hospitals. They have a lot of staff in the healthcare sector, and this basically an extension to what UCL have been promoting over the years in Global Business School for Health. We teach students how to think. Of course, we start from within and not what to think, rather than, because that will be the outcomes of how to think. And we are part of a great tradition of disruptors making the world better. As one of my colleagues said, be a disruptor or just prepare to be to be disrupted. So we create these type of questions. We question the norms and phenomenon or phenomena. There you go. So we are among the best in the world. We're 9th in the world's top 10 universities. We're 2nd in the UK in research strength. We've got 30 Nobel Prize winners. I think we've got 32 now. Over 2 weeks ago, we've got another two Nobel Prizes for the university. We are the University of the Year in 2024. And we've got more than 16,400 academics and professional services. 1/3 are non-UK and 840 professors. We are the first business school in the world dedicated to educating the next generation of health and healthcare management leaders. We create leaders. We look at the global healthcare management. We would like to make a change in the in our style of dealing with complex situations, rather than to look at it only from health perspective. And we look at the challenges from business perspective. We use as I always promote to my students, we use the right side of the brain to manage the complex challenges in health, and we question how to inspire public good in terms of healthcare management. Business School for Health. It's a long story. I started, with the start of this school myself. So Business School for Health is basically one of those schools that produces and creates solutions to unchallenged challenges that were not solved over the last few years. Of course, that was an encouragement from COVID, and we started to think loudly about how things can move better and faster. What did we learn out of this situation? So the solutions require different education that allows the the past of health and healthcare disciplines to be replaced by interdisciplinary thinking and actions. And that's why we ask we got students from different backgrounds, we got students from different countries, and those students, they work together and they contribute to the success of our courses. We partner with, with public and private organizations. We look at the NHS as our partners. We look at the private and health and charities as our partners in evolving the health ecosystem and discover solutions that are quicker and more efficient for populations. So the Business School for Health, we teach business sides of soft skills to manage complex challenges in healthcare, and that is embedded in our structure, that is embedded in our modules, and it's embedded in our genes. So whatever you're doing in GBSH, you're basically targeting the health, but you talking about it, or you approaching from a different perspective. So UCL also prides itself by delivering undergrad and postgrad degrees. I myself, I'm leading the biotech and pharmaceutical management. You can see it in our programs, at the bottom of the page. And we have an interdisciplinary health and business faculty. We are basically the world experts, leading experts in the field. We don't only cover the subjects, but we solve interdisciplinary health challenges. We look at the cases, we discuss the cases, with students, we learn from the history, we also use simulation and experiential learning. So, we look at things differently. We teach you how to look at these things as well. It's not only just to provide you with the solutions, we're asking you also to be active and propose solutions to these challenges. So our degrees that are available now, the BSc Business and Health, the MSc Digital Health and Entrepreneurship, the MSc Biotech and Pharmaceutical Management, MSc Global Healthcare Management, and we've got 3 routes under that program. And we've got the MBA Health and Executive MBA Health. Also, we have the PhD and DBA. Our research is basically divided into the 3 subsections. So the first one is the systems and policies. We are aware that we don't have one standard health system across the world, but it changes with time, and the speed of changing can vary between the countries. So the aim of that research direction, or the research theme in GBSH, is to strengthening primary healthcare in the context of rapid urbanization, commercialization, and ecological changes. Improving the governance of mixed public-private health systems to create public good and advance health equity. But also we have the health management, because health, it has other aspects in terms of being digital, disruptive health platforms, and improve health and healthcare. We use the AI and data-driven. We look at the micro and meso level, which is within the organization and within the individuals, rather than we look at the macro level or the external, as in the health systems and policy. We also look at the operations and financing, and the third theme of the research, where we apply the economic evaluation and value-based healthcare approaches to achieve efficiencies in health delivery. We're comparing the models of financing and healthcare and analyzing the drivers of health spending. We believe that the financial sustainability would really lead to a contribution to the management and the systems at the end, and how this will gonna act as an ecosystem in place across the world, and it varies between the countries. The exciting news that we've got the BSc, the MSci Business and Health. It's our only undergrad degree so far that we offer to students in business and health. We have business schools. They are too broad. They are too much focused on different aspects and different angles. But this is designed, for business and health students. So the core business curriculum, including accounting, marketing, finance, strategy, entrepreneurship, coupled with cutting-edge courses in health and healthcare. So you can see both sides of of the science, and we have specialized route of health management and health science, and also we have business placement and study abroad options for MSci route. So the starting date will be September next year. The duration is 3 years for BSc and MSci 4 years. The entry requirements is ABB and the A levels, and the location will be at UCL. And you can see where UCL is. You can see here the Marshgate here on the right side, and you can see Wimpole Street on the left. I'll talk about the buildings and the facilities in a minute. So why we believe business and health make a good BSc to students? We offer you a comprehensive understanding of health systems. We look at business side, health industry insights, gain fundamental knowledge of health systems, policies, and practices, and we help you to develop these business skills that most of the health professionals, they are too much focused on. They just don't focus on, during their studies. They focus on nursing, so they focus only on the nursing direction. But we develop the business skills, as part of the curriculum. We're also addressing challenges with business solutions. We will teach you the problem-solving skills. We will give you the cases. You will have to find answers for these cases. We will discuss these cases with you and make sure you understand it. And we will also offer you entrepreneurial mindset to think about the opportunities, how to innovate and drive change. Because it's not only to identify the change, is how to drive the change and maybe how to adapt the change quickly. And this is how it varies between the countries. And we will look at the career. Your career, you're basically looking at different aspects, the diverse, community. You can basically think, I always tell my students, who you are, will define your career. Not the program by itself only, but it's also about you. Is what you want to be. You want to be, for example, in the sector, in the finance, in the leadership position, driving the changes, or do you really want to make a different direction in terms of sales and marketing or commercialization? Who are you will define. We will figure this out together during the program. And then we will also teach you the transferable business skills, that's literally applicable for industries. We will bring cases that are, for example, from the UK or from Europe, from all over the world, just to give you, a flavor of how health systems can be different in different contexts. We will also bridge the gap between clinical and administrative roles. We will teach you the effective communication and how to develop a skill to bridge the gap between clinical professionals and administrators. And also in terms of leadership settings and how unique can be, unique challenges in managing healthcare organizations, and leading the change can also be part of the process. So as I said, from a business perspective, business schools, they are basically, in my opinion, I used to teach in the business schools, and we used to focus on different angles. We used to give examples, but not, consistently using the healthcare. We use the motor industry, we use other, industries, but this is a dedicated program for business and health. So the employment in the UK in life, in life sciences industry has increased massively over the last few years, and that's coming from the government. So there will be high demand, on the individuals with this type of skills. You can see that we've been presenting in different conferences about the need and the demand for these skills. The structure of the program, sometimes you're not very sure that you would like to go for BSc or MSci option. So this is basically just to give you, just a breakdown of what's in there. There will be 20 compulsory modules, 15 credit modules, and 30 credit projects in the final year. That will come up with 360 credits in total. You will have the business and health research project, which is the 30 credit modules, and the capstone in health and in business and health, sorry, that will integrate academic coursework into practical experiences to hone your skills in application and transition from academic environment to complex environment of health and healthcare. So this is the PSC and BSc, and then that will take you up to 3 years. The MSci will be different. You will have more credits of 480. And you know, that's 20 compulsory modules, and you will have the 120 credit study abroad or placement option, plus the 60 credit dissertation. So so there will be more modules in there. You might study abroad. We are basically in the process of having contracts with different places across the world, in the UK as well, to offer you know, study abroad and maybe work placement. And again, we are basically building these contracts with these employers to offer to our students. We are bringing together your learning from across the program in the dissertation and produce an original piece of work when you submit the business and health dissertation at the end of MSci option. So scholarship and funding, of course, we love scholarships, we love funding. So I strongly encourage you to think about this as well whilst you're doing the application. So for the MSci fees, pay undergrad fees in all years, and we'll get 4th year undergraduate fee and maintenance loan if eligible, rather than postgraduate fees loan for master students. We have the UCL undergraduate bursary, you know, stranger student bursary and care leaver bursary for students who live or have lived in care. And there is also another initiative by UCL that I put on my LinkedIn the other day, which is students coming from you know, countries with crisis. They offer some support, but that will be for postgrad, not for MSci and BSc. And we've got the government loans, the UK student finance. They are eligible for home undergraduate students, you know, can get a tuition fee loan, a maintenance loan, in addition to supplementary grants such as childcare grant, parents learning allowance and stuff. And we've got the US federal funding as well, that's also available. And we've got other fundings for disabled student allowance that's also available on the website. Please have a look at the website at UCL. UCL is basically, their aim is to develop you know, individuals and make the world better. So look at the website for funding and the bursaries. You know, we'll be more than happy to help you as well in your requirements. But at GBSH, we also offer more funding opportunities for students. So we offer 11 scholarships of value of 5K. And, you know, of course, there are selection criteria is based on the academic excellence, you know, as you can tell here. So use that. You have to apply. Once you apply and you get secured a place, you can apply for a scholarship. You'll have to make sure that you tick all the boxes before you make the application. And then we have the undergrad health impact scholarship, and that's 10K, that's 10 available. And that is available for international. That's available for international fees, for international students, overseas fee paying students from countries that receive official development assistance. And also, you know, for home students, we have the undergrad excellence scholarship, and that's available for the home students. So we've got 2 scholarships available for international students and 1 available for the home students. And that's also after you secure a place, then you can apply for these scholarships. So take that as an opportunity as well when you make the application. So wow, this is a nice one. So this is, if you look at the UCL East, you can see the stadium, you know, and you can see where UCL East is. So UCL is in the east side of London, and it contains a lot of walking spaces, lovely area, you know, and there are so many facilities. It's very close to Stratford Station. It's about 18 minutes walk probably, or maybe 15. It depends on the weather and if there's, and depends on you if you walk fast or you walk slow like me, maybe. But it depends on how, it's about maybe about 18 minutes walk. And also we have, also there's a mall. I can't see it on the map here, but one of the biggest malls in Europe available as well with loads of outlets, for students. It's very close to the Queen Elizabeth Olympic Park and so many sightseeing in the area. Of course, when you visit London, you will see a lot of these opportunities, and areas to visit. So this is our lovely building, Marshgate. So it's a state-of-the-art facilities in the heart of Olympic Park in Stratford. Exciting new student accommodations available, which is across the road from Marshgate. Each bank cultural educational destination also nearby. So many destinations in there. They say about 13 minutes here in the walk from Stratford, and we have loads of sports facilities. So if you want to use the bicycle and stuff, there are so many areas that you can use around Stratford. So this is me at the end. This is the Marsh Gate. That's the building. And if you have, let me just stop sharing. And if you have any questions, or maybe there are some questions here in the chat, I'm more than happy to answer your questions.
Before we get to all the questions all of you are asking, but we would like to ask all of you first, where are you guys joining from? So I have now launched this poll on where are all of you joining us from today. So if you could please take 30 seconds, a minute to answer that, that would be great.
Thank you very much, Nada. So we'll give it 30 seconds before we go to the questions. Nada, shall we make a start for the questions? Or
we can make a start. Yeah.
Yeah.
So the first question I have here is, what would the prime motivator for prospective students to enroll to this truly innovative BSc MSc program that is launching from the next academic year? So I think this one would be more directed towards me, what the prime motivator for a student is to come here. Honestly, personally for me, it was to see such a unique blend of this intersection of healthcare and business. So all this really equips you with such skills that is, I'd say, very valued in the healthcare landscape today. And aside from that, there's so many traditional business or healthcare programs. This is not it. So this course really fosters a lot of innovative thinking, specifically within the healthcare management and policy and entrepreneurship. So it really prepares students more in the real life and the real world to tackle any challenges in terms of business solutions and healthcare. So it gives you that competitive edge. So I guess that was the motivator in terms of why I enrolled.
Well, thank you very much, Nada. That's really comprehensive. And as Nada said, Nada, I think you're frozen. Nada?
So next question.
Yeah, thank you. So as Nada said, we just look at the different aspects, and as I said, the business schools, the available business schools are quite general in terms of what you were gonna consider. But this business school is unique because you're doing this for health. So the next question is how important you consider the direct interaction with health sector work industry in terms of accepting program graduates, as well as providing opportunities in terms of research commercialization, thus generating extra revenue for the program, is very important. We're not separated, from the industry, and we are basically part of it. As educators, we look at the education as part of the industry rather than to be another step or something to be detached from the industry. What is truly, and the next question is, what is truly expected from the same, person? So what is truly expected from the forthcoming new program director in terms of teaching and research? We want the new program director to be, leader and influencer and be, inspiring person to work with others and to let the students, see them or see the students in a different angle. The next question from the same person. So how open will the program be in accepting healthcare professionals as external collaborators who can act as mentors for the program in terms of providing insights? Please, by all means, you can email me, you can reach out, and we can discuss this further, because we are basically launching the program and we are looking forward to, to provide more details about all these. The next question from anonymous attendee: how many people are admitted into the program? I think that would be question to my colleague here, Barry. I think we're looking for 70 in total, Barry. Am I right?
About 100.
About 100. So we're looking for 100. We've got loads of applications already, more than. So I would strongly advise you, if you're interested, just make the application ASAP. If my personal statement does not really mention the health industry, but only mentions economic and management, is this acceptable? Yes, of course, but we need to see, what is the motive for you to join. I always say the personal statement is an investment. So take that as an investment. I'm gonna remind you when you join the program to read your personal statement after 6 to 8 weeks from starting the program and to see what you have written, at the beginning and where are you now. So take that as an investment. We just need to see the motives behind, joining the program and what do you expect. I always see the program from the eyes of my students and to see what angles or what do you really want to be after graduation. So it's very important. Your personal statement is very important to me as much as it's important to you. What is the profile of A-level subjects on the course? I would ask Karina or Barry to step in and answer this. I'm sorry, I can't hear you, Barry. Yeah, I can hear you now.
There's no specific subjects we prefer. UCL does have a list of A-level subjects that they accept. We can find that on the website and send the link in the chat.
That's perfect. Thank you very much. If you put the answer for the attendee, the anonymous attendee who asked the question, will be great. Thank you. And what are typical career routes? That's a very good question. That's a very good question. You're coming to do your undergrad degree to find a better job and a better life, and you are basically aiming to reach out to where you want. So the typical career routes will be probably at the starting point of being part of the team, the management or administrative team for healthcare professionals. So you can work in the insurance if you're basically overseas or local. You can work in insurance companies overseas. You can work in hospitals. You can work in pharmaceutical companies. You can start your own. So there are so many ideas or so many directions that you probably need to consider. And I always ask my students the question, if you close your eyes, where do you want to be after 5 years? What career you would like to consider, within the coming 5 years. So you need to consider all these in mind. And then when you define it, then you target, you reach, what are the steps that you would like to take forward. You will have to do the undergrad degree, and you're going to learn something. So how the undergrad degree will going to feed into your dreams and get you to the career that you want. So another question here from George. So how much maths is present in the course? We don't teach maths. I don't know if that is the right answer for you. We teach economics, we teach finance, we teach accounting. We teach, if that is, the definition of maths will be different, in the program. So you will deal with numbers with these I have a slide on the structure of the program that I can share with you if that helps. So let me share my screen again. Just a sec. There we go. So this is the program structure. I removed it because I found that this is available on the website. You can always look at it at the website. So year one, you will have the accounting and finance, innovation, and there are also business ethics, principles of project management, research methods. We also have the healthcare finance, health economics, as I mentioned. There's also other aspects of the life course here, approach for health. And also for the MSci, this is where you split between the BSc and MSci. So you can see the operations they involve AI. There's also data analytics and AI in healthcare, a part of it. And for the MSci, you will have the opportunity to choose routes. So I deliver that module, for example. Policies and practices will be option for the MSci route, and you're gonna work with or meet with colleagues from different master's programs. So this is basically the structure. Let me just stop sharing and go back to the questions and answers. So this is the structure of the program, for both MSci and BSc. I think I've answered the question about the employability. We tend to secure placements, and we are basically promoting this program to a lot of employers. They find this really interesting. So we've been in touch with some companies who are really willing to get you into the, for example, for 12 months as a placement, or to work with them for a year, which is for the MSci route. So from there, you can tell that these programs, you can work in the registry, for example, pharmaceutical company, you can work in the supply chain, you can work in the insurance companies in the UK and maybe overseas. So there are so many opportunities. There are so many opportunities that you can take forward. The next question, how many people will be recruited in this session? I don't have an answer for that. That's the question to you. If you would like to be joining the program, you're welcome. We don't have that target, if that makes sense. As I said, we've got loads of applications already. So if you're interested, so please make the application ASAP. Who are the partners students would work with during the program? Who are the partners students who would work? I don't get that question. Maybe you're talking about the partners. We have partners with different pharmaceutical companies. So we've got funds from Hoffman La Roche, Baxter, Novartis. They are willing to work with us, and there are so many other companies in the pipeline. So we're building this type of partnership with these companies. We also have partners with charities, the NHS through UCL hospitals, and we're part of the Faculty of Population Health, and they are basically promoting our programs. So we have the partners in place, that would support students during this program. Will there be any change for placement in hospitals associated with UCL? Um, and again, I trying to understand the question. So change in placement, we will start next year. So we will not offer change until we start. So the plan is to have this placement sorted before you join the program and get those who are going for the MSci option to find their place ASAP. How many people work in a class? Maybe you're talking about how many people, how many students in the class. So we aim to not to exceed the 30 in the seminars and the lecture theater where when we have the lectures, to deliver the lectures live to students. Then we have all the students in one classroom if possible. But if you're, working in tutorials and seminars, then you work with probably about 30 students in the seminar group. What is the place of the patient in your business and health program? Patients is in the heart of everything we do. We can't separate the patients. Patients, it's in every lecture, in every seminar. Patients is basically what we teach the students to take care of. So teaching students will always be about the patients and will always be about sustaining the healthcare systems to the benefit of the patients. So what was the precursor for, I'm not sure of this major, I'm not sure I understand the question. So if you can basically amend it or resend the question, of this major, which one are you talking about? Are you talking about the MSci or BSc? And can you please clarify? Maybe you can answer. Well, Barry is typing the answer for you now. Is having the economics and maths level background preferred? Look at the UCL website. So I've got here, Nada wants to answer, or maybe she will answer the question here about the maths. The next one, how useful the medical work experience in my application? Very useful. Very, very useful. But make sure that you write it down in your application. Make sure you have it in your statement. And I consider those who have work experience to be partners of the program and to work with us to talk about their experience in the lectures and the seminars, to share what they have been doing over the years before joining the program. In my opinion, this is a win-win situation. So it will be extremely useful, and make sure that you highlight this in your application. We've got another question. Which are the differences between the health management and health science route? That's a very good question. It's a very good question. So the health management is basically, we look at the leadership aspect in the managerial style. We look at the leadership, how you manage the change, how you manage the changes within that aspect. But you need to look at the different angles of the health business. But the health science would cover everything, including scientific aspect of the health and how these routes can be differentiated. Then another question here, chance not change. And again, I would need more clarity. So a chance to change, maybe, I don't know, what does that mean? So if you can clarify the question, please just retype it and send it again. Is it better to do science degree before the MSci? Well, it's up to you. So what works best for you is your choice, and doing a science degree before the MSci, that would prolong probably your degree, your undergrad degree. But again, if this is something that you would like to do, by all means. I can't really have an answer for that one. What is the student experience like at UCL East? So I would say Nada can answer this question. Nada and Karina can answer this question rather than me. So I will start with you, Nada. Can you answer this question? Nada, you're frozen.
So
Can you hear me?
I would
Yeah.
say very dynamic. very dynamic, very diverse. You have such world-class facilities around you. You have different landmarks around you. The people as a whole, you can't ask for nothing like anything better. You have a lot to do. You have the, like we had mentioned in the PowerPoint, I think we said we have the Stratford Olympic Park. Just wait until it hits summer. You'll just see so much like people around and student experience. That's in as a UCL East. I think because it's such a new facility, a new campus as a whole, it's much more vibrant, in my opinion. I would walk in and it's just very vibrant in my eyes.
Yeah, fantastic. Thank you very much, Nada. Karina, what do you want to say?
I think it's a very different experience because it's in the east. Now that it's autumn, right outside the Marshgate building, you can see the leaves changing. There's a little river right outside the building. So after lectures, it's really peaceful to get some reflection time sitting by the river. And the building itself is very quiet. I found it very easy to focus throughout the year. So definitely be excited if you're applying.
Okay, so I just want to tell you that Karina did her master's degree here with us, and you know, she's now with us working at GBSH, and you did Global Healthcare Management and Leadership, isn't it? So so now she's, you know, she is now in the marketing department working with us. So this is the experience, you know, from students' perspective. And to be honest, I always feel like I wish I'm a student to be part of the programs here at UCL. It's there are so many activities for students here in the East, and at UCL, the Central as well. They offer a lot of support to students through the student union. So can the school guarantee accommodation for the 3 year or 4 year period? Yes, when you join the program, you will become part of the program. So it, you know, when you secure a place in first year, you will be automatically transferred to the second and third and fourth year period with no issues. You know, if that answers your question. And again, the question here is a very interesting one. How should I write my personal statement to cater for this course, as this is the only one of its kind, but make the personal statement relevant and other courses at other unis, just in case I don't get in. So as I said earlier, a personal statement is something that you would like to invest in. It's not that, you know, just to let you go to the course, as much as it's something really specific about you. What do you want people to know about you in your personal statement? Most of the students, they just customize it according to the to the program that they are in. I would ask you not to do that per se. Use it for your own, and use it for the job, you know, or the dream job that you would like to you know, to apply, or you would like to join. I would use the personal statement, you know, for example, I'm here presenting my name, blah, 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 and I would like to join the program because it helped me to get to the career in hospital management, or to become in a career for insurance, or to become involved in a career with a hospital and work with the nurses and doctors. And then you go back to the program diet to see which modules that would feed well into your personal statement. I would like to be in the investment department. I would like to start my own business, you know, to start a new clinic, you know, in XY country. And this program would gonna help me to do that. So I would advise you to customize it based on you. And again, don't use the same personal statement for all applications. One size doesn't fit all. Make sure that this is customized for other programs that you would like, you know, to select from other universities that you would like to consider as well. I'm here to you know, to guide you and inspire you as much as I can. This program is doing well, and it will be perfect. But again, you know, it's your choice, and what is the choice that you would like to take. It's something that, you know, embedded in even in my delivery of the program, that Karina and Nada would know that it is your choice. So go for it and talk about yourself. Do write more than one personal statement. Maybe that would feed into different programs. So the next one is, what proportion of lecturers are delivered by people in the other departments in UCL? We are basically, George, we are basically at the same level of other business schools. If you look at the ratios between the students and the lecturers, we are basically within the same level. So we don't have labs and we don't have clinics, we don't have hospitals, so we don't have experiments where we will need more lecturers to be in the labs and more a human factor to be in there. We are delivering the lectures and the seminars in the lectures in the cinema room or in the theaters. So the proportion of the lectures, it will be quite acceptable within the AACSB standards and assurance of learning. Is the entry requirements for business and health BSc set to be competitive? Would the base requirements change the chances of being offered a place compared to the students with higher grades? I would strongly recommend you to apply ASAP. Secure a place ASAP. Get yourself into the system. Think about, get your data, get your application scrutinized. Maybe there will be some more requirements from the team, from the admissions. They might come back to you with some questions. So it will be competitive, I'll have to say. There are criteria that we published on the website, so please take care of that. And in the statements, it's quite important for you. And that there's another question that just pop up now. Is this course first come, first served? Indeed, yes. So whenever you apply, you just go through it. We'll just make sure that you basically can secure secure a place. And again, I always encourage students to apply before January, before February, ASAP, because the application will take so long. And again, this is the first program, across the world, and there will be, there will be a lot to add. There will be a lot to add during the program. We will add more, diversity. We'll add more structure that would help also in your future career. Your future career is quite important, and you're investing your time, your effort, at GBSH or any university, and you should basically benefit from that. So another question here, my PS is more focused on finance, mathematics and statistics, but I'm also very interested in business and health majors. Do I have any competitiveness? Of course, yeah. Well, I'm trying to understand the question. So you're applying to this because you're focused on finance and mathematics and statistics, but you're also interested, of course. Just make that crystal clear in the application and make sure that you invest in your personal statement. I always promote invest in your personal statement because you're going to read it. You're going to show us, why you would like to apply for this program. And you're going to read it again, after you join the program to make sure that you are basically in the same trajectory as you expected. Wow, we've got 29 questions. That's really interesting. Do we have any more questions?
I think we are done with the questions, but if anyone does have any further questions, I'm just gonna pop the GBSH email. And also just to wrap it up, as a whole, I would definitely say that I found the learning environment within GBSH and my course as a whole very challenging, but also rewarding. So you have the campus itself, you have the modern facilities, you have the collaborative spaces, you have the diverse people that lets you really engage with your studies in very new and interactive ways. Like I personally came from a scientific background. So this switch from thinking of with your right brain to your left, it's been very different, but very, very rewarding as well in a way. but also beyond the academics, you have this growing community of UCL East that is very exciting. And it's not just about the coursework, it's about the environment and the people that encourage us to think innovatively. So you have Radi, for example, who always encourages you to really apply this business mindset into such a sector and to connect with your colleagues and faculty from everywhere. So that would be just a quick wrap up. So again, I have now attached the email if anyone has any more questions. And thank you all for being here and engaging. And thank you for Dr. Radi, Karina, and Barry for such an excellent session. And yeah, have a great day, everyone.
Thank you very much, Nada. Thank you, Karina and Barry, for joining. There's also here a question about who's going to be at the open day tomorrow. I'm not very sure if Barry and Karina can answer this question. So I think that would be in person open day Marshgate. So that will not be online. Am I right, Karina? Would you like to just to answer this?
Yes, we are having an in-person open day at Marshgate tomorrow. There will be different professors and different students talking about their experiences. I think it's from about 1:30 to 5-ish. So if you are based in London and you want to drop in and see the campus, definitely come for that.
That will be great. So if you're around, that will be great to see you as well. I'll be in the office tomorrow, but I'll be teaching. But anyway, if you have any questions, please reach out. Nada put the email address on the chat. So make sure that you reach out to us. And again, your investment is our investment. So keep it up. If you have any questions, again, reach out to us. Thank you very much, everyone. Have a great day ahead. Thanks, everyone. Thanks, Nada, Barry, and Karina.
It's the bottom right.
Thank you, everyone.
Thank you.
Cool.